Well, hi everybody and welcome. My name is Neil Seidman and I'm co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. And welcome to our webinar. The title of our webinar is OCD and Sibling Relationships: How to Cope When Your Brother or Sister Has OCD. And our presenter is Dr. Michelle Witkin. So before we start, I'd like to say just a little bit about ADAA. That's the Anxiety and Depression Association of America. So ADAA is the leading organization, the leading nonprofit in the field of anxiety and depression. And our mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education, like this webinar, through practice and research. And one of the things that's really central to our mission is working to end the stigma and to get the word out, you know what, these conditions are common, they're real, and they're treatable. So I want to invite everyone to visit the ADAA website. That's adaa.org. And it's really a great resource. So one of the things you'll find right from the homepage is our directory of treatment providers. So you just click on Find a Therapist. And then we also have a free peer-to-peer online support group. So you can again find that right from the homepage. And then also you can support ADAA by making a charitable contribution on the website. Okay, so let's get started. So I'm really happy to introduce our presenter. Michelle Witkin, PhD, is a licensed psychologist. She has over 25 years experience. She's in private practice in Valencia, California, where she specializes in treating children, teens, and adults with OCD, that's obsessive compulsive disorder, and anxiety disorders. Dr. Witkin is a clinical fellow of ADAA. She's a graduate of the Behavior Therapy Training Institute of the International OCD Foundation, which is a very important organization in the field of OCD. Dr. Witkin also has firsthand experience with this topic as she has raised two terrific young adults, one of whom has OCD. So let me turn it over now to Dr. Witkin.
Okay.
Give us just a moment as she can bring up her.
Turning it over here.
Great. There we go. Excellent.
All right. Hi,
You go
Neil.
to. You want to go to your slideshow mode? There we go.
Yeah, got it.
Coming through great.
Okay. That looking okay?
Yeah, looks great. So great to have you. Really
Thank
appreciate it.
you. Thank you. It's really exciting to be here today. Although as I was sharing with you as we're getting ready, I'm feeling a little bit nervous today. So, but hopefully we'll have some fun talking about this too as we're going.
Great. Wonderful.
Okay. All right. So, I, I I thought it might be kind of nice to talk about even why we're talking about this topic today first. Um, and so the idea for doing this topic actually it came up to me for a number of reasons. One is I see a lot of families where there are multiple kids in the family, and maybe one kid has OCD, but the others don't. And something we know about OCD is that it does affect the whole family. So whether people are trying to be careful not to upset the person who has OCD, or whether they're actually helping them with some of the rituals that they do, everybody tends to be affected. And brothers and sisters are affected in their own really special way. And I see this not only in the families that come in to meet with me, and also the kids that I see who come. I run sibling support groups too at some conferences, the OCD conference actually, and and the siblings always come in with their own special concerns. But we also live this as a family because I have one. They're adults now, but one of my kids has OCD, the other one doesn't. And the one who does not have OCD, he faced some interesting challenges because of his brother's OCD. And there wasn't a lot of information for him at the time. And I thought, and for me as a parent too. So I thought it would be terrific for there to be something for brothers and sisters so that they could learn a little bit more about OCD and about how to help themselves too.
I can imagine being the brother or sister of a sibling with OCD and just feeling lost and confused. What's happening? Is it my fault? What am I supposed to do? All these kinds of questions. And so this is such a great topic.
Yeah, or even what is going on here, right? Because
Yeah.
sometimes the change can feel pretty big. So I actually think a good place to start with is what is going on here. So um, I think starting with what is this thing that my brother or sister has? What is OCD, right? So as you were saying when you first started, Neil, OCD stands for obsessive compulsive disorder. And it's actually pretty simple. I mean, there's two parts to OCD. So I like to say the first part is obsessions. And obsessions is nothing more than it's kind of a fancy word for saying that a person has unwanted thoughts, images, or they feel like they have urges, and they really bug them. And your brother or sister probably feels very upset or uncomfortable um, by these thoughts, images, or urges. And Neil, do you hear a little bit of feedback?
Yeah, but it's fine. Yeah,
Okay.
it's
Okay. Yeah, and one of the things that I will say is that those thoughts, they become so bothersome. They're almost like, those sticky notes that you can peel off and stick them onto things to remind you of stuff. It's almost like
like
having
that.
that gets stuck to your brain,
Right.
right? Right.
Like it gets stuck on my brain like that.
Yeah.
And I
And
can't
of
get it
course,
back,
we're
except that I
not.
can't get it off easily, right?
Yeah, yeah. I mean, because a lot of times people say, why don't you stop thinking about it? They don't go away so easily, is the thing. So, and I have a few examples of some obsessions that your brother or sister might be having. Um, they might have fears that they might hurt themselves or somebody else. They might be worrying a lot that they've done something wrong. They might feel urges to do things just right. They may have images coming into their mind of somebody that they love getting hurt, like mom or dad. They might worry that they've upset God or some other religious figures, and they might be afraid that they'll make a mistake. So, another one that we hear a lot of is they might be afraid that they're going to get sick. So those are
So
just a
what,
few examples.
yeah, so any one of these I can imagine making me feel very anxious, any one of these kinds of thoughts.
Yeah, yeah. And usually these thoughts are about something that is really special or important to your brother or sister, right? So if, imagine like you love somebody and you start to have worries about, hurting them in some way or them getting hurt. That's very scary.
So that's the what's called the obsession. That's the O part of the OCD.
Right, right. And then the next part is part two is compulsions. Again, another kind of fancy word. And it just means the things that people do to try to make the thoughts and the feelings go away. And they might make them go away or they might make them feel better, but only for just a little bit. Because OCD is kind of a trickster, right? It gets kids and adults too. It gets to feel a little better. And then, of course, the thoughts or the images come back and then they get stuck and they've got to do them again. So it can be over and over again. So we also call those rituals. Some kids I know call them habits too.
So that's an attempt to get rid of those anxious thoughts.
And the feelings actually, right? I feel yucky. I want that feeling to go away, right?
Mhm.
So I'm gonna do something that's gonna make me feel less uncomfortable, less anxious, right? So there's, some examples you might see are a person might be checking doors or make sure that they're locked or be checking lights. They could be saying prayers over and over. By the way, you might not even see that. That could be something they're doing in their mind, right? They might confess. I know, some kids might go to their parents and they're confessing things that they might have done. Maybe I knocked over so and so's markers in class today. Maybe I bumped into that kid. They might be tapping or touching things. So you might notice that they're walking a certain way or touching things, and it would be until they feel just right. And that's a very, that's how the person feels, right? It's not about it being right or not. It's just how if they feel that it's right. They might wash their hands, clean things. They might have to write or rewrite their homework over and over, erase. They might feel like they have to think certain good thoughts. If they had a thought that they felt was bad, then they might feel like they have to replace it with a good thought.
So if I'm the brother or sister, maybe one thing that might help me to understand is that these rituals and compulsions that my brother or sister are doing is the reason they're doing them is because they're trying to feel better. They're thinking that if they do these, they wash their hands 16 times until it's just the right way, they were trying to feel better.
That's exactly it. It's like they just don't want to feel this way. And you can imagine like how horrible a person must feel to do things that on, to everybody else it looks like this seems really strange or like some kids will say weird, right? And a lot of times your brother or sister knows that it looks weird or knows that it sounds weird to other people. So imagine how awful they must be feeling if they're doing these things.
So they were trying to feel better by doing the compulsion, and it made them feel worse in a lot of ways.
Well, yeah, I mean it's kind of it's a sticky trick, right? At first you might feel a little bit better and it feels like that's worth it, but then the getting stuck feels pretty bad, yeah.
Yeah. Oh,
Yeah.
so I love this next slide. I'm imagining being the brother or sister. Why did this happen to my brother or sister?
Yeah, yeah. And I wish that there was a really simple answer to this one. There's not because we're actually still learning about OCD.
Okay,
Um,
I'm sorry to interrupt. If I'm the brother or sister, my first question is it something that I did?
huh, that's a really good question, and actually I do get asked that a lot. And the answer is absolutely not. You didn't do anything to cause this, nor did anybody else. Nothing that another person does causes OCD. So we do know that it tends to run in families. So, kind of, um, it could be something that is in the family. So maybe if a grandparent or a parent or an aunt or uncle has it, someone else might have it. Um, but nobody did anything to cause it. And sometimes it'll come out like if someone's going through a really difficult time. Um, But again, no, you didn't do anything.
That's good to know if I'm the brother or sister.
It's really good to know, right? Take away that sense of responsibility. All right, so now we know what OCD is, but let's talk about what a brother or sister might see, and also a little bit more about how it might be affecting them. So, I've got some different examples. So, one thing you might notice is your brother or sister is doing these things that look unusual, and they're doing them over and over again. Okay, this is a really common one, right? Seeing your sibling getting really emotional. A lot of times, what you're going to see is that one of those uncomfortable thoughts or images came up and your brother or sister got really mad or really scared and maybe they even like fell down on the ground and started screaming and tantruming. That is something you might see. Um, and they might not be interacting with you in the same way anymore. Like maybe they used to play with you and they're withdrawn a little bit. Um, your brother or sister might actually be acting afraid of you, right? So actually in our family, there was one point where my son with OCD was afraid his brother was contaminated and he wouldn't touch him. He had to be far away from him. So you can imagine what that's like when you're sitting in the back seat of a car and your brother or sister crosses their legs or something, right?
Yeah.
Yeah, they look scared.
What is a typical age that a child might start showing some symptoms of OCD?
Goodness, it's so funny as I was just looking at this yesterday. I believe it's somewhere between 8 and 12, but
Okay.
I'm not absolutely positive about that 'cause I don't have the numbers in front of me right now, but I believe it's between
It's
8 and
pretty
12.
young, pretty young.
Yeah, yeah, it
Preteen,
is.
preteen.
It's
Yeah.
pretty young. That doesn't mean it always shows up then, but in kids, yeah, that's frequently when we see it. I've seen it younger, seen it in kindergartners, and some of my colleagues have seen it even younger than that.
Yeah. So if I have a brother or sister,
Mhm.
and maybe I'm a little bit older or maybe just a little bit younger, and everything seems fine, and then one year they had developed this condition, it's a natural thing. Is it something I did? So that's really, really good information, I think, for the
Yeah,
kids, the
yeah.
brothers and sisters to really know it's nothing to do with anything you did. This is
Well,
just what happens with OCD.
yeah, especially if they're afraid of you, right?
Mhm.
Then you can really think, did I do something bad? Right? And it's not really that they're afraid of you, it's that their thoughts are telling them that something going on with you is scary, meaning like that maybe you touch something that they're afraid of and now they don't want to touch that too or something like that.
Mhm.
Um, so another thing that can happen too is your friends might notice and they might tell you your brother or sister is weird. That doesn't
Mhm.
feel very fun.
Mhm.
Um, you might also see a lot of your mom and dad getting upset with your sibling. It could be happening a lot, right? Because even though parents are, try very hard to be patient, when you've got someone in the family who's getting upset a lot and being bugged or doing a lot of rituals, um, parents can lose their patience too. And so sometimes you might see that.
Now, another thing that comes to mind is if I'm the brother or sister, that my sibling with OCD uh, might be getting a lot more attention than me. That's
Yeah,
an issue that comes up.
yeah, absolutely. And there can even be some feelings of, and I'll talk more about feelings, but you might even feel like left out or maybe even a little jealous because maybe you don't want to be having this hard time your brother or sister's having, but boy, they're getting a lot of attention from mom, and
Yeah.
that can be difficult. Um, so and that's the thing when
Oh,
it when
I just see that. I just saw that part on your slide. That
yeah
was the next
yeah
part. You
yeah
caught up with your
exactly.
sibling. Yeah.
Yeah. And on the one hand, it's like, yeah, they do need to be, um, but also it's like you have the right to want to have time with your parents too, you know. You might see a lot of quiet conversations or arguments. So families sometimes will, parents might go and talk quietly in another room together or with the sibling who has OCD. And you might be wondering what's going on there, or there might be arguing going on too. Um, this one's a big deal, right? You've got activities planned and they get ruined or they don't happen because your brother or sister's having a hard time with something, and now that thing you were looking forward to, it doesn't happen.
I can imagine being the sibling uh, and being resentful,
Oh yeah,
frustrated, resentful. Yeah.
oh yeah, oh yeah. And I watched a lot of that in our family. I remember one time going to the park and um, there was something that happened and the one brother got very upset and just could not get himself together and we had to leave the park and I remember his brother being so very very upset and it made perfect sense.
Yeah.
um, There could be a lot of therapy appointments, and you might even be getting dragged along to those therapy appointments, brought to them. Maybe you want to go, maybe you don't want to go, but that's something that might be new in your life. This one is an interesting one. Teachers or counselors asking you for help. So this tends to happen a little bit more if you're the older sibling, but sometimes adults might think you know how to handle it if your brother or sister's having a tough time. And they might come to you when you're sitting in class or when you're at some kind of a camp and say, can you come and help us with your brother or sister? And maybe you want to be helped, but maybe you just want to be left alone too.
Sometimes maybe that could feel good, maybe. Could a sibling like having that, feeling like they're playing an important role or
Yeah, I think that that can differ by sibling and what mood they're in, right? So
yeah,
sometimes it can feel really great to be helpful,
yeah,
but think about how sometimes it doesn't feel so great to be bothered if you're in the middle of something that's
right.
important to you,
Yeah,
right?
that's for sure. Yeah.
Yeah, so it can go both ways, absolutely.
Now, one thing that's coming to my mind as you're teaching us more about this topic is this is a big deal well, obviously for the sibling that has the OCD, but it's a big deal for the brother or sister that doesn't have the OCD. It's
It is.
really, if I'm the sibling and my brother or sister has OCD, this is a big deal in my life, even though I don't have OCD, but this is still it really is affecting me.
Yeah,
And
yeah,
maybe just to the parents that are watching,
exactly. I think what
Mhm.
happens. Yeah, I'm sorry, Neil. What were you saying?
No, I was just saying for the parents that are watching, uh, just to appreciate that this is a big deal for the siblings,
Yeah,
to
yeah.
acknowledge this is a big deal for them too.
It definitely is, and I think speaking both as a psychologist and a parent, right? When there's one child who is suffering, we will tend to put a lot of our attention into helping that child, rightfully so, right? Um, but it's just I think that this is to part of the point of this is to help us remember that we've got to actually pay attention to the whole family, and brothers and sisters definitely need to be paid attention to in this.
Yeah.
Yeah. And then I pulled up here just a bunch of different ways that that you might be feeling if your brother or sister has OCD and you see all these things going on. And and I'm not going to list all the feelings, but what I am going to say is anything that you might be feeling is absolutely acceptable, understandable, normal, you know. And because I think that some kids might feel guilty if they feel mad or or frustrated, and no, it's fine to have whatever feelings.
I think that's a really important message to the siblings and also to the parents that the sibling that does not have the OCD, that it's okay for them to have their emotions.
Absolutely, and just to have the
It's actually
space,
good for them. Yeah, it's
right?
good for them to be able to feel like they can feel their emotions.
Absolutely, yeah. And if they can, then they have the opportunity to deal with them.
Right.
Well, now we're moving on to a different area, which is really about okay, we know about OCD, we know how it's affecting you, and but now what? Can your brother or sister get better? And I think sometimes that what's happening in treatment is a little bit of a mystery for brothers and sisters. Like I like to bring siblings into to treatment, but they're not always in treatment. And I think hoping to have more information, helping to make this not such a mystery is a good thing. So, okay, so what happens? Your brother or sister, if they go and they get treatment, yes, they can definitely get better. There's definitely treatment, and it can be really, really effective, really useful and helpful. So the main line of treatment that we do for OCD is something called cognitive behavior therapy. So your sibling will go to see somebody who really understands OCD very well. So in the beginning of when they go to treatment and they go to see a therapist, they're going to be doing a lot of learning. Right. So the therapist is going to be someone who's specially trained to really understand OCD. Hopefully that's who they see. And they're going to teach your sibling and hopefully your whole family all about OCD. Right? The more you know, then you know what to do about it. So a lot of kids might notice that their brother or sister gives a name to their OCD. I like to call OCD a trickster. Some therapists might call it a monster. Um,
That's a really cute monster you have on your slide. So,
And I wish I could claim credit for this one. It's one that a good friend helped me find because I like to say that that OCD is, although it can feel like a scary monster, it's actually really kind of a goofy monster. It doesn't have any real power, and that's why I like the word trickster better because it pretends to have power, but it really doesn't. So when your sibling goes to see a therapist, they might even be asked to give it a name. And you might look at that and go, well, why would they give it a name? There's not something really in my brother or sister's brain that's a trickster or a monster, right? And no, there's not. But giving a name to the OCD and giving them something to call it and even something to look at, it helps your brother or sister blame themselves less, and it gives them something that they can stand up to. Right now, I can stand up to this when I'm learning to do battle with my OCD and to beat
so
it.
it can be part of them getting better to give it a
Yes.
name, and even a cartoon character or drawing. Their own drawing would be even better, right? If they draw it themselves.
Yeah, and as a matter of fact, that would be what they would do. Is they would draw
Oh,
their own.
right. Right.
So, yeah. I wish I had a bunch of drawings to show you. I don't, but they can be very creative.
Uh-huh.
So another step in getting better from OCD is a therapist will have your sibling. They'll usually have them rate their fears, and it might be on a scale that looks a little bit like a thermometer. Um, and that scale might be from 1 to 10. It might be from 1 to 100. It doesn't really matter the numbers, but usually it's the higher the number is, the more scary something is. So if your brother or sister, let's say, is feeling scared that, let's say that things are dirty or contaminated, they might rate what things feel the most scariest to touch or be near, and the things that feel the least scary. And what that helps for is the next part of treatment, which is picking what are some of the things they're going to do to stand up to their OCD. And I actually call those brave experiments. Um, the technical name for that is exposures. But what will happen is your sibling is going to practice being brave and standing up to their fears by doing these experiments. So they might practice, say, touching things, or if they're confessing, they might start to practice maybe confessing a little bit less, and then seeing what it's like to be brave and not to give in to their scared feelings.
So if I'm the sibling, questions coming to my mind. So the therapist is teaching my sibling these things to start to get better. Can they really get better? Can most kids get better?
They absolutely can get better. I see lots of kids in my practice, and I would tell you that most of them get a whole lot better.
Wow. So that's really, really, again, a really valuable message, clearly for all the parents that are watching, and also for the siblings to know.
Yeah, I mean, it can be pretty frustrating or scary or anything watching them go through it. And I think I know some brothers and sisters wonder, like, is it ever going to get better again? And um, and yes, it definitely can get better again.
So
Uh,
can you tell me more? Can you give an example, another example of a brave experiment? Just
um,
example.
Sure, sure. So let's see. Let's say that this is an interesting one. There was a little girl I worked with once who she was afraid if she looked at dogs that she would turn into a dog. That was the thought that was bugging her. And so what we started doing was first we started drawing pictures of dogs, right? and she would practice looking at those pictures of dogs, and then we started.
And that was hard for her to do.
It was very hard for her to do at first, right?
But that's where
So
the brave part comes in.
exactly, she was being brave while she was looking at it. I have
How does that help a kid get better doing something?
Well, that's a really good question. So how does it help me get better? So what happens is your brother or sister, they get really good at running away and not being and well, we said in the beginning this is about trying to feel better, right? All the compulsions or the rituals are about trying to feel better. Well, what happens is they get pretty good at not feeling uncomfortable. So what we do is when we start to do these brave experiments or these exposures, we do something that feels maybe just a tiny bit scary, not big scary, just a little bit scary or uncomfortable. And so when they do the thing that feels a little uncomfortable, now they're practicing not running away, not giving in. And it's almost like, when you exercise and you get stronger and stronger when you exercise, or when you practice and you get better and better at your sport, you get better at standing up to fear or things that feel scary. And that's how they get better.
So it's like strengthening the muscle where I'm facing up to that trickster.
Yeah. In fact, I say that a lot, that it really is like strengthening your muscles. And a lot of kids really understands it in terms of doing a sport or a hobby, anything that they got good at, that they got good at it by practicing doing it over and over again.
Uh-huh. So that example of the child that started out just drawing a picture of a dog and then looking at it, that was practicing being brave.
Exactly. And then she worked all the way up to being able to be around dogs and to touch dogs.
Wow, that's not OCD. If she could do the thing that was tormenting her, and now she could do it.
Right. Exactly.
Yeah. Oh, okay.
Just a word about medication too, because you might find that your sibling is taking medication, and so sometimes kids who have OCD, they do take some medication. It might just help to make the OCD feel a little less strong to them, so that they're better able to find their ability to be brave and to stand up to that trickster.
So it's okay if my brother or sister is taking a medication?
Of course.
Okay.
Of course. Yeah. Right. We want to find every tool we can in the toolbox to help your brother and sister.
Okay.
So, and I like to think of medication as it's another tool. Okay. So, all right. Now we know how they get better. What about you? What do you do? So let's talk about that. So talk is actually the first thing. So it's really important that you talk about how you're feeling, about what you're going through. And also talk to learn about what's going on too. So who could you talk to? Talk to your parents. Talk to your brother or sister if they're still willing to talk to you. I realize for some kids they might not be willing to, but if your brother or sister is willing, talk to them. Find out what it's like for them. Find out maybe even what their OCD is about. Some kids will tell you exactly what they're going through. Now, sometimes it might feel like it's tough to talk to someone immediately in your family. So you could think too about, are there other adults in your life who you trust? Grandparents, aunts or uncles, teachers, religious authorities, coaches. There's so many people who might be in your life who you could talk to. And then some people want to go completely outside of the family. And if you feel like you need to, you might want to talk to a therapist, especially, like you were saying, Neil, this can be really challenging for a sibling. They might want to have their own therapist.
What's the value, if I'm the sibling, of having these conversations? How's that going to help me feel better?
Well, what it does is it helps any questions that you have, it helps you to get them answered. It can also help you to feel less alone, right? If you're having a lot of feelings and you feel like you can't tell anybody about them, that can make you feel very, very lonely and isolated. And so talking to somebody can help you feel much less alone, and it can help you get some support too.
Okay. Well,
Okay.
that's a really good step. This one is gonna, I can imagine, help me feel a lot better.
Yeah, definitely. Um, it's important to learn about OCD, and if you're watching this now, you're already learning about it, so that's great. There's also great books out there. You can go online to websites and find information. And if you feel like it, you can go on your own to learn information. But you can also ask people to help you find information too. It doesn't just have to be you go out and find it. And the reason I say learn about it is I think that having knowledge it makes you feel less scared. It makes you feel more in charge and in control. And I think the more information that you have about what's going on, the better you're going to feel.
One of the things I can imagine that I might learn if I'm the sibling, as I learn more about OCD, uh, that uh, it isn't my sibling's fault that they have it. Uh,
Exactly.
and it's also not something they can just on their own, you know, solve.
Right, right. And I think something that you learn from the more information that you learn that if your brother or sister could, they wouldn't even have this OCD thing.
Right. Right.
Well, yeah.
Right.
Okay. So I call this part stepping out. A lot of times what can happen is when you're the sibling, you get caught or you feel like you're caught in the middle of all of this. So whether you're watching your brother or sister have a meltdown or get upset, or whether you hear people arguing, um, you can feel like you're caught up in the middle of all of it. So stepping out is about how do you kind of regain your time for you, that life is not going to be all about OCD for you. Because sometimes it can feel like that, like life becomes all about the OCD. So I think one important step is to let your parents or other adults around you, if your brother or sister's having a tough time, let the adults handle it. It's not your responsibility to help. Um, Meaning, you're not in charge of it. Um, Make sure
I
that
get
you're
to have,
doing things that you enjoy. Yeah,
so glad we get a little glitch in our connection. Hopefully it'll come back here.
were you about to say something, Neil?
Yeah, we just had a little
Oh, there
glitch
you
in our,
are.
I think it's back now. Yeah, I was just going to say, and then you just
Okay.
went into the thing. I was just going to say, I get to have my life. I get to have my own life. And then you were saying, do things
Exactly.
that you enjoy. Let the adults take care of the kid with the OCD for now. Let me go do things that you enjoy.
Right, right. And you should never feel guilty about having your own life. Like I've seen some brothers or sisters who are a little worried about, well, is that a bad thing that I want to do my own things, that I still want to draw or read or play video games or play my sports or whatever? And it's like, of course, you should have a life. I mean, because the more of a full life you have, the better you're going to feel, and the more you're going to feel like you can actually be there to help your brother or sister when you want to, right? Or to learn about the OCD. So it's important to still be doing things you like.
Now, what's the?
And you may
Tell
even,
me more about tell me more about the last one on the slide where that says plan for when you're asked to take care of your sibling.
yeah. So, like I said earlier, a lot of siblings might find that adults will come to them to ask them to help them calm down the situation. So, if that's something that's happening for you, or if you're a parent for your child, you would want to make sure that there's some sort of a plan. Like if a teacher or a yard supervisor or a counselor or somebody is going to be coming to you or to your child who doesn't have OCD and asking them to come and manage the situation, you might want to have some words that you've practiced. So adults and kids can practice these together, but what you might be able to say. it might be something like, oh, when they've got a tough time, it's important to give my mom a call, or when that happens, I think he has a plan that he's supposed to go to the office, or so I think it's important to know, like, what is the plan, and then you can communicate it so that maybe you don't have to be taken away from what you're doing.
Okay.
Does that answer that?
Yeah, so like be maybe have something to say, or be prepared for situations where adults might be coming to me as the sibling, to be
Yeah,
prepared, so it's not going
yeah.
to interrupt my my activities.
Right, too. And I think also, right, when you're a kid and you're looking at an adult, it can feel really hard to tell an adult no, right? But you do have a right to be able to say that, but having a plan about how you'll say it and what you'll say can be really helpful.
Right. So I have a right, if I'm the sibling, I have the right to my own life, do things that I enjoy, to have my
Yeah.
own happiness in life.
Yes, yes. And something that I didn't say really directly, I had said, go do things that you enjoy, but make sure too that some of these things are actually scheduled. So whether you're involved in sports or you have a hobby or it's just having time to go and be with your friends, talk with your family about getting those things on the calendar for you so they're regular. Because when things get busy and happening with OCD, sometimes these things they don't happen unless they are planned and on the schedule.
That's a great idea. Get it on the calendar. Okay.
Mhm.
Oh, okay, here's one more question for you, Dr. Witkin.
Yeah.
I'm the sibling and I'm doing these activities and I'm, doing this some enjoyment, and maybe I'll feel guilty. Here I'm out having a good time and my sibling with OCD is not having such a good time.
Yeah, yeah. I would say that that's not at all unusual to have guilty feelings. And what I can say about that is like what we said before, it might be normal to feel that way, but at the same time, you have nothing to feel guilty about. The more that you are doing things to take care of you, the more patience you're going to have, the more you're going to be able to contribute if you want to help and contribute. So nothing to be feel guilty over.
So it's better for my sibling with OCD to have a happy sibling like me, as opposed to someone that's really miserable.
Right, right. If you're both miserable, that's
Didn't
no
help.
fun, right?
Right.
I even think about me, right, as a mom in a family, right? Sometimes I leave to go to work or I leave to go and have my own activities. And if maybe I left in the middle of a tough time, I come back feeling so much better because I got to just get a little change of view, right? And now I'm better able to deal with tough stuff. So yeah, so as a brother or sister, it'll help you to be able to deal with stuff better too. All right. Okay, so the next part is what else can you do to cope and help? So the slide says help out with treatment if you want to, right? And I think that if you want to part is important because not every sibling actually wants to help. They might be like, I don't want to have anything to do with this OCD stuff. I want my parents and the therapist and my brother or sister to handle it, right? And there is absolutely nothing wrong with that. If that is how you feel, then that is okay. Okay. But let's say you do want to help because some kids do want to help. And I have siblings who come in and ask me, what can I do? So one thing you can do is you can learn from an OCD therapist about OCD and what to do. In fact, if your brother or sister is willing and their therapist is willing, I actually, and most of my colleagues, they do bring the whole family in, talk to their therapist, learn about what's happening with
Be
their.
part of one of my brothers, my siblings' sessions, like be part of one of their sessions.
You might be part of their session, or the therapist might see you alone to talk to you alone and get your point of view and to give you
And
information.
someone I get to ask questions of too, that's helping my sibling. Okay.
Exactly. Exactly. Again, like, the more you know, the better you're able to deal with it, the better everyone's able to deal with it, right?
Yes.
So, yeah. So you can go
And
in and you can
then I see on your
so
side, learn how to help with exposure. So as the sibling, I could help with the brave experiments.
yes, you could. You could. In fact, it can be a lot of fun. I've had brothers or sisters who really wanted to help, and I remember there was this one girl, and whenever her sister was practicing her exposures, her experiments, she would be her cheerleader. She would say, "I know that you can do this. You're strong. You're stronger than the OCD." And she would even, pretend like she was talking to her brother or sister's OCD monster, and she would say, you can't take, you can't do anything to my sister." And they would actually start to giggle about it, and it would make it. I think it helped her sister to be braver. Um, and I've seen it where, also in some of the families I've been with, I'm thinking of a brother and sister pair that I know of, and they would go out, and the brother was really afraid that things were contaminated and they would make him sick. And so they would go around and they would find as many things that they thought were dirty as possible. So they'd touch shopping carts, and they would pick up trash, and they would have a lot of fun. They would challenge each other who could do more. And so that was really helping the sibling who had OCD to stand up to it, but it made the sibling who didn't have OCD feel like they were helping, and they could see their brother and sister, um, getting better.
What a change from the earlier scenes that you talked about of the suffering and the brother or sister that doesn't have OCD and how it's impacting them. And now you're talking about getting better, and the brother or sister that does not have the OCD can be helping, but also having fun.
Yeah,
That's
yeah.
fantastic.
Yeah, it can be fun. For one of the families I worked with, we had a celebration party at the end, and we had a popcorn party. And again, this was one where the the brother was concerned about things being dirty, and they started throwing popcorn on the floor in my office and eating popcorn off the floor, which is
And when they're having fun,
yeah, which if it, I know it sounds sort of silly, but if you can go from being terrified that anything might have accidentally touched something that could possibly have been dirty to I'm throwing it purposely on the floor and eating it after it fell on the floor and laughing about it, that's a big change, right?
now
Or
as the sibling, sorry to interrupt, as the sibling, the young kid, who's the sibling, I might have an ability to be silly that's more silly than the parents. I could be really silly with my brother or sister that has the OCD.
so true. And in fact, this is a great reason that brothers and sisters can be a big part of helping their sibling to get better, because they can, well, they can be goofy and funny and more kid-like, right?
Right.
So, um, I have here too about learning how not to be bossed by the OCD. You know, so we started in the beginning by saying that OCD can affect the whole family, and that you might be being told by your brother or sister, well, you can't touch that, or you can't do this, or you can't watch this because these things bug my OCD, right? Um, and part of what you can learn in therapy too is how do you slowly back out of OCD being who's in charge, So if OCD is saying, no, you can't watch that on TV, you can learn how to slowly back out of it. You don't want to do it just on your own. You want a therapist or your brother or sister or your parents to help you know exactly when to take those steps. But it can make you feel much more empowered if you can learn how not to be having your life controlled by the OCD.
So things that I do as the sibling that my OCD sibling had me not do, okay, and now starting my doing things that are important to me that are tough on my brother or sister in a way. But that could be a brave experiment.
It definitely could. It
Yeah.
definitely could. I think that you want to be careful not to come up with your own brave experiments that your brother or sister doesn't agree with.
Okay.
Right. So, the, meaning, if let's say you decide that it's time for your brother or sister to watch that TV show that their OCD says is too scary, you might make them really, really mad, and they might not want to practice stuff with you. But if it's something that you decided together that you were going to do, or even together with the therapist that you were going to do, that's when you would be doing them together. So,
Got it.
yeah, you decide it not one-sided as a partnership.
Okay.
Yeah.
Okay. Good.
All right. So I think that that is most of what I have here. Yeah, it is.
Wonderful. Wonderful. Um, and I loved hearing that with some good help, the cognitive behavioral therapy with a therapist that has some specialization with OCD,
Yes,
that most kids can get a lot better.
right.
I just love hearing that.
Yeah, it's a
I
nice thing to know,
Yeah,
right? Because that and somebody who does have some of that special training, they know all the tricks OCD plays, and they know exactly how to help your brother, sister, and you to be able to break free from it.
yeah. Are there any particular resources, websites, or books that you think are especially good for a parent to look at?
Well, obviously ADAA has good information on OCD. Um, there's also the International OCD Foundation, and you can, as a parent, go looking. There's even a section in there that is specifically for parents about children.
So
Um,
people can just Google International OCD Foundation and it should probably come right up.
yeah, it's actually iocdf.org.
IOCDF
.org.
org. So just the initials, everybody, if you want to get another really good resource, IOCDF.org. Excellent.
Yes. Yeah. So,
Wonderful.
yeah.
Well, thank you so much, Dr. Witkin. It was really,
Oh,
really helpful.
I forgot to say too that on that website too, the OCD Foundation lists some really good books. ADAA has those some of those books as well. But if you're looking for books to read with your kids, there are some terrific ones listed there.
Great. So people that are viewing the webinar, if you think of a question that you'd like to ask Dr. Witkin, you can go ahead and send an email, webinars@adaa.org. And if you want to put in the subject line Dr. Witkin, and then periodically she'll have a chance to address some of these questions. Um, So, G, again, thank you so much for your presentation.
Definitely,
And
thank you. Thank you so much for giving me a chance to share this. I hope that some brothers or sisters and parents find that it can be really helpful for them.
so thanks again, and thanks everybody for watching, and we'll see you next time.